Well, welcome to Wednesday night. Welcome to the community interview. Sorry, I'm about 2 or 3 minutes late. I do apologize for that. Very excited tonight, we're bringing in Dr. Tom Mollsen. Tom is a physical therapist in Chicago, and Tom loves treating TMJ. He's an expert at it, so we're excited. He's coming in to end our week-long series on TMJ pain, causes, and treatment. So welcome. If I haven't met you before, my name is Dr. Michael Gorman. Welcome to the iMove TelePT community. I am a fellowship-trained physical therapist, and I'm the founder of iMove TelePT. So glad you're here. All of our Facebook Lives events are about you all. So please chime in, interact, let me know how you're feeling. I'll be asking you a question here in just a minute as we welcome Tom in. But anyway, I want to thank you for being here. And please, if you know of somebody that someone that has TMJ pain, please invite them to watch this right now. Share this with them. TMJ is jaw pain. Okay, so please share this. I'm going to go ahead and bring in Dr. Tom Mollsen.
Hi, guys. Hi, Mike.
Hey, Dr. Mollsen, how are you doing today?
That's fine. Thank you. How are you? Good to see you.
You're doing good. Well, welcome. I want everyone to please give Dr. Mollsen a warm emoji clap. Please, I want to see these things scroll up. Let me see that. So welcome aboard. Tom, if you don't know, he has been a loyal follower of iMove TelePT since day one, since April 1st. So he has a wealth of knowledge to share with us. And Tom, I'm looking at your name up on the screen. Man, that's like alphabet soup.
Crazy.
You got any Z's in there? Or, wait, let me see. I got A. I don't see. You better go back to school. I don't see a B. I don't see a B or a Z. So. So Tom lives in Chicago, and Tom, it's very important. The other night I asked you, well, I wanted to make sure you're not a Cubs fan.
No.
Because I'm not so sure we could have you here. I wanted to welcome you though. How about that?
Yeah. I like all that. Well, I'm not really a Hawk fan either.
Are you a Blues fan?
I do like the Blues.
Okay.
Yep.
So
you're Sox.
You're a Sox fan, which is exactly why you're on, and you're a Bears fan, right?
Bears are good. I like the Bears.
Well, Tom, are the Bears really good though?
I don't know if they're doing that good this year. Or if they have they have a season, but they didn't do so hot last year, did they?
Yeah, no, I don't know. I don't think so.
No,
hey, you know what? You have a football team, and that's the most important thing.
Right.
Anyway, I want to welcome Tom aboard. And I do have the first question of the night for the community.
Okay.
What is your favorite food to eat in Chicago? So, all right, I'm going to take a little second while everyone thinks about that. I got Nicole on. Thank you for joining. And Nicole is a big White Sox fan. She's from Chicago.
Good gal.
We got Brian on.
Brian who?
Yeah, that's exactly it. Brian who? Yeah, Brian's on. We got Nicole on. Others are going to be joining soon. But Brian said the Bears need Ditka.
They do need Ditka.
Yeah. Anyway, so my favorite food in Chicago is Lou Malnati's pizza.
There you go. Me too. That's my favorite one.
It is?
Yeah. Lou Malnati's. If people are coming here, if I'm going to take them for pizza, we go to Lou Malnati's. Now, people argue. A lot of people like Pequod's. I went down to Pequod's, and I think Lou Malnati's is better. So we just had an OGI, Ola Grimsby Institute event here just before this pandemic.
Yeah.
Big lunch was Lou Malnati, or dinner was Lou Malnati's, and everybody loved it, and it was fun.
Then everybody fell asleep because they had carb overload after that.
Well, the next day, yeah, they were, but they enjoyed it. It was fun.
All right, so Nicole likes deep dish pizza.
Mm-hmm.
Brian likes Portillo's Italian beef.
Yeah, Brian likes Portillo's. He told me that before. It's very good. I like Johnny's, I think, is a little bit better, but Portillo's is a good Italian beef.
All right. So even if you're not live on this, you guys, if you watch this, a rebroadcast of it, put your favorite Chicago food in there, because I'm going to check that out, because I love food. And Nicole says Lou's is definitely better. So anyway, so please, guys, interact with us. Give us a thumbs up if something you like hearing. Give us the heart sign. If you think Tom is super cute, give him a heart sign. And I did forget to mention, Tom, that you are the owner of Midwest Manual Physical Therapy. So I can congratulate you on that.
Thank you very much. I appreciate it.
You're welcome. So welcome aboard. What we're going to do next, Tom, is I'm going to ask 5 questions for the TMJ expert. That would be you, not me, but that would be you.
I'm gonna, I know who some good TMJ experts are, and like them, but we'll try our best.
Okay. So first question, tell us about your educational journey and what led you to start Midwest Manual Physical Therapy.
Okay. Well, to start, let me say my congratulations on your new endeavor, and wish you all the best. And anything I can do to help you, I'm trying out here.
You're doing it.
I talked to a patient today, and so she might do some telehealth stuff, and I said I know the guy, so we hope that works.
Thank you.
But, my educational journey was a bit goofy. I went away to college. I spent 2 years up at a school in the Twin Cities, and I didn't know what I wanted to do. So I came home. Ended up studying massage for a year at a place called the Chicago School of Massage Therapy.
Okay.
And after that, was working as a massage therapist. I had private little practice. I was taking courses at a junior college, and ultimately ended up going to a liberal arts school here in the Chicago area called Elmhurst College. Mm-hmm. And it's a NCAA Division III school, and I studied athletic training there. And just the year, I was there 2 years maybe, and when I finished, we work in a basketball camp, and my mentor turned to me and said, "Hey, look, you just took the exam. We just found out you passed the exam. I'm going to take the job at Northwestern University. How you need to go and become the new trainer at Elmhurst College." So I was kind of thinking I wanted to go PT school, but this opportunity came up, and I thought, well, I can take prerequisites for free. So I ended up being the head athletic trainer at a NCAA Division III college for about 9 years. Right. In that capacity, I was responsible for the care and well-being of student athletes participating on 14 intercollegiate teams. I was also the head trainer for the Nike-sponsored Michael Jordan, Scottie Pippen, B.J. Armstrong, and Kendall Gill basketball camps for about 9 years.
Great. Did you meet Jordan and Pippen?
I met them all. I met them. I taped them, taped their ankles, taped their fingers, had beers with some of them. It was fun.
Very cool.
They were all great. It was exciting. And after that, after about 9 years, I was ready to go to school, and I got into Midwestern University.
Because you go to school about every 5 to 7 years, right?
Years. We went to Midwestern University and graduated from physical therapy there, and then took a job with Health South.
Oh yeah.
Worked for Health South for about 2 years. And then about a year and a half, 2 years, and that fell. And when that went down, I worked with the doctor who was our team physician at Elmhurst College. He bought that clinic from Health South. And I was there 9 years, and then decided I wanted to do something different. I worked for a big corporate group for about 5 months, didn't like it. And then I ended up working at a orthopedic physician-owned physical therapy group here in the Chicago area. And it was great. We were one of 7 clinics. I managed that clinic. And during that time was when I went to the Ola Grimsby Institute and went through their residency program at your spot in Chesterfield, which was fantastic. Yes. And thanks for that. And then I did the fellowship. And when I completed the fellowship, I approached the people at work and at the business, and I said, where do you see me going with the company? And they were like, we want you to be an educational director. And what I didn't know is that educational director meant I left management. And they moved me out of my clinic, and I had none of the stuff I had been training to work on. No pulleys, no high-low tables, no any of that. And I just, I did that for a year and a half, and I thought, I think I'd like to make a change. And we went on our own, and here we are. So we opened up last July. We were doing great in the beginning, and then holidays kind of hit, and we took a little bit of a dive. And then once we got through January and the holidays, we started picking up, and then coronavirus. So
it'll come back, I promise.
Yeah,
so you've only been open since last July?
Yeah, only since last July. So.
Congratulations.
Thank you.
I can't believe you've done all this if you're only 29 years old.
Only 29. I'm older than you, Mike.
You have no gray hair. That's
I do.
Pretty impressive.
Yeah, I'm waiting for who to say something. He's going to say something.
Oh, he did. He already did. I got my eye on him. Trust me.
Yeah. You do.
So we have someone else chimed in. Chicago style hot dogs is their favorite.
Excellent. Jude and Jude's is my favorite one.
And Brian said, Tom, who was your favorite person in the fellowship program?
Well, of course, Brian. He was my buddy. You know something about, now see, anytime you say Brian Pugh, anybody who knows him, they get a big smile. I mean, that's what I'm going to say. Right? Good guy.
Very true. Hello, Maureen, and thank you for joining us tonight. She says hello and welcome, Dr. Tom.
Oh, hi. How are you, Maureen? Thank you.
Okay, so we want to talk more about TMJ. You are our TMJ expert, so I figured we should start to dive into that.
Okay.
What specifically made you interested in treating TMJ? Because, as you know, not many physical therapists treat TMJ.
Right.
So what sort of led you to want to treat this type of therapy?
So there were a couple of things. When I was going through the OGI residency, Ola Grimsby Institute residency program, I was of the old curriculum. So of the old curriculum, you had to, they gave you a list of things. And if you wanted to get a doctorate in manual therapy, not only did you have to pass the curriculum, you also had to do a research portfolio and then defend that. And so I wanted to do that. And as I was looking through a pamphlet that they gave me, or a document, a packet with a bunch of different topics, I wanted a joint, and I wanted to see.
Whoa, hold on there, Tom. Be careful there, buddy.
It's legal now.
We keep this PG. Oh yeah, it's legal in Illinois, isn't it? Okay, sorry. You can keep talking about it.
So I wanted a joint in the body that didn't have a lot of already a great deal of research there. So in doing that, I found, well, temporomandibular joint, there weren't that many studies. And the second thing is I started to look into those studies. I was like, these studies are poor. And they were not the best studies. I could find something wrong with everything I was picking up. Mm-hmm. So the third thing was that my dad, my dad's a dentist. And I thought, well, if I had issues or questions on anything, I could, talk to him about it and have him see what his thoughts were on things. And that's kind of how it went from there. As I went through the program and I completed the research portfolio and went through the defense with Dr. Karen Dubrow, and that was like a 4-hour thing on one day. And at the end of it, she said, I want you to present at the OGI forum. And I said, oh, okay. I said, I don't like doing all that. And she said, oh, come on, you got to do it. And she said, the keynote speaker is going to be Mariano Roccabato. Now, Mariano Roccabato in the PT world, he's the guy when it comes to the temporomandibular joint. Mm-hmm. And so I said, why do I want to go and talk to Mariano in front of Mariano Roccabato? I'm ripping. Everything I'm saying is that the research that's been done is very bad. And she said, well, Mike Gorman's going to present. Mike Gorman will present if you'll present. Will you present if Mike presents? And I thought, well, if Mike is going to present, well. So anyway, I said I'd do it. And the thing is that as it was getting closer and closer, I was becoming more and more concerned about the fact that everything I was saying was the research was bad news. Mm-hmm. And so in talking with my dad one day, he said, look, you need to talk to an acquaintance of mine. This gentleman's name is Dr. Charles Green. Dr. Green is the director of oral facial pain at the University of Illinois at Chicago's dental school. And he's their expert. He's the equivalent of Mariano Roccabato on the dental side. Okay. And I did speak with him, and my dad set that up. And in talking with him, he must have spent like 40 minutes with me. And we talked about my research and what I had found. And at the end, he said, and I'm going to quote what he said. He said, I respect what physical therapists are able to do, and I readily refer my patients to them. However, he continued, the research relating to the use of physical therapy as a treatment modality for temporomandibular joint dysfunction syndrome continues to be limited and needs to be more scientific and hold up better to scientific scrutiny. Well, that was exactly what I was saying. As I said, the research is bad. My problem was here's a gentleman bigwig outside of our
Mhm.
community, and he's saying our research is bad. And I thought, I know there are therapists out there that I'd seen, Jojo Saison in particular, when I was with him, a lot of TMJ stuff, and they do great work. We need to shore up our research to support the great work that we do. And so that's where I really thought, if I do a study, I want to do it in this area, and that's kind of been where I'm at then. So that's
Yeah.
a long way, but yeah.
Thank you. Thank you so much. All right, next question for you. One or two main causes that you find of TMJ pain. I've spent the last 2 Facebook Lives of mine really talking about causes, but from a clinical standpoint, when you're treating these people day in and day out, what are you seeing as couple main causes?
Yeah, so Mike, if I look at this joint, first of all, it's a very complex joint and it's a very controversial joint. And when you talk about controversy, there's controversy relative to how do you define temporomandibular joint dysfunction, the anatomy of the joint, the biomechanics at the joint, the causes of this disorder, the evaluation and the treatment of it. Outside of like direct trauma to either the jaw or the temporomandibular joint, there is no consensus by those who study it or by those who treat it as to one or two main causes for temporomandibular joint dysfunction. Instead, there seems to be some agreement relative to a multifactorial approach or cause with a combination of variables that are at play here. And I think that's the key. I'll give you another article. So this is from this book, Jeffrey Okeson, one of the best books on the temporomandibular joint. And what Dr. Okeson says, it kind of along this, is he says, traditionally, most treatment of temporomandibular joint dysfunction syndrome has been dependent on a single cause theory to which the individual clinician subscribed. The management of this disorder was primarily based on treatment selected by the clinician's personal biases rather than controlled scientific investigation. As a result, treatment approaches have varied widely, and the success of treatment was often compromised by a limited approach that addressed only one part of the problem. And I think that's the thing. I think we need to look at things like occlusal factors, parafunctional activities, biting, if the person bites their nails, bites on a pencil, or holds a pipe and clenches it in their mouth, emotional stress, pain itself. You talked about before, the posture, the forward head posture, that craniovertebral junction, arthritis, degeneration, congenital disposition, like does a person have a hypermobility, like they're hypomobile throughout their body, and the jaw is one of those areas, or trauma. It may be that a patient presents with one variable that overrides all the others, but it will not necessarily always be the same variable in every individual. I think you need to look at it from a multifactorial approach, and that's where I think that the way we're trained to evaluate, that whole body evaluation is so important, because if you just limit it to the jaw, it might have nothing to do with the jaw. One thing I can tell you for certain, the number one reason people come for treatment is jaw pain, and that is a fact.
Right. I found, to be honest, my experience, most times a TMJ patient, they're going through a high level of stress, or they've gone through for a period of time a lot of stress. Yep. And the other thing is, it just seems to be more female than male.
Yeah, definitely.
And I think a big part of that is females, for the most part, tend to be more hypermobile. Their joints move more than males, and I think that's a big part of it. But
yeah, so depending on, some studies say it's a 4-to-1 ratio, women to men. Some I've read say 9-to-1. And also one of the topics that was brought up there was, is it a hormonal thing, and does it fluctuate with that? So hard to say. Yeah, could be. I too, I see, Mike, I see a lot of people with forward head postures, and there always seems to be that some emotional aspect behind it. Yeah. So
right.
Who knows?
I think some of it can be the fact that a lot of people have TMJ pain, and it's not really ever diagnosed, or no one really knows what to do with it. So they're sort of passed around, and maybe they're given an anti-inflammatory or night guard, and that can help, but not always. So I really think just doing a holistic view of the entire body is the most important thing.
Yeah, absolutely.
For sure.
Right.
A couple people joined in. I want to recognize them. We have Tanya and Michael. Thank you guys for being here tonight. We have Yusuf from San Diego, California. Beautiful San Diego. Thank you for joining us, Yusuf. We have Elizabeth is on. And also we have Maureen on, who she is a very experienced nurse, and I'm going to read something she wrote. While as a pain management coordinator, I assisted my two pain specialist anesthesiologists with TMJ. The blocks were with TMJ nerve blocks. Yeah, we haven't really talked too much about TMJ nerve blocks. The nerve blocks were beneficial for a temporary period of time, about 2 or 3 months. However, they weren't able to establish a long-term relief. And what we try to do from a manual physical therapy approach is to try to find what the cause of the problem is. Just don't treat a symptom, because if you just treat a symptoms, 9.8 times out of 10, it's going to come back. So, all right, great. Okay, next question for you, my friend. Okay, so let's say I have TMJ pain. What should I do to get on the right track? I've been dealing with this for a while. Where should I go?
So I'll give you a couple of steps. I think the first thing to understand is that oftentimes temporomandibular joint dysfunction syndrome is self-limiting, and it does resolve on its own over a period of time. That said, there is volumes of evidence over the last 20 to 30 years of scientific research, both large number of longitudinal studies as well as multi-continent studies, which indicate that the best way to treat temporomandibular joint dysfunction syndrome is a conservative treatment program. Just as important, there is no evidence out there to suggest or to demonstrate that an invasive or irreversible intervention are more effective or beneficial than the conservative methods. So the key here is the less invasive the treatment, the better the outcome for this patient population.
Yeah, for sure.
It could be less is more. The next step is to recognize that you need to have a collaborative, multi-professional approach. That's what's necessary for the successful resolution of this syndrome. We want a team of professionals working on it. Harold Gelb, right here, he wrote another great book on this years ago, and he said there is no place for intellectual isolation in the holistic approach, as you just said, holistic approach to the diagnosis and treatment of this clinical entity. That all being said, if there is someone that you know that has temporomandibular joint dysfunction syndrome, either in the audience or someone who has a friend or family member that has it, I would recommend they seek out and consult either a residency or fellowship-trained manual physical therapist, a certified craniofacial physical therapist, which is now, I think the APTA has a group that's doing this now, and they go through a pretty extensive program. I think I looked at it, I think they had like a 2-year mentorship kind of thing, or 2,000 hours. It was 2,000 hours. It's pretty cool.
Well, you know, that could be your next step. After doing that, would you get any more letters after the name?
I don't know. They might take it away.
A B or a Z would be great for you.
Yeah, I need a Z there. Yeah, you're right. You know, I looked into it. I looked at it. I don't know. I don't. I mean, there's some other things I'd like to do. I think we can treat it. I'll be honest, Mike. I think that in the program that we went through, you, me, Brian, Yusuf, I think our background, I mean, we had a rigorous curriculum, both the resident fellowship, you did the 3rd year. I think with the training that we had, we are in a great situation to treat this disorder if it walks in our clinic. And I think, like I said, the key thing is that you do that, you have full body eval. And then you work with a group of people. And a dentist is the third thing. You want a dentist that treats TMD or TMJD in a conservative manner and who's willing to work with the therapist. There has to be that give and take, you know. And I've worked a lot with my father, and I've learned a lot. And, you know, it's interesting to see how that goes. But if you have that back and forth, it works out very well.
For sure. Yeah. Great. Brian checked in. Brian just made a comment. I want to read it. Nerve blocks, great short term, but think you would need to address cause of the dysfunction for long-term success.
Yeah.
So is it a joint problem? Is it a muscle motor output problem? All those.
Let me tell you, I'll be quick. I had a case just recently that came in. It was actually referred to me from my allergist.
Okay.
The patient also went to my allergist. This patient was a lady. She had experiencing pain on and off for much of her adult life, but headaches, migraines, vertigo, blurred vision, ringing in her ears, jaw pain. And this patient came in. She had in her, when we did a screening, and I sent her to my dad. Anytime I have a TMJ patient, I send it to the dentist. In Illinois, we have direct access for everything but TMJ. So you need a dental script to treat it. So I do the screening, and if I determine that the jaw is involved, I send them either to their dentist or to my father. This lady had 8 weeks. This patient had 8 weeks of formal physical therapy with a TMJ specialist. This patient told me the work involved mostly soft tissue stuff on her face and work on her jaw, nothing else. Now, she did improve motion, but at the end of this, she still had quite a bit of pain and saw her dentist, who referred her to a dental TMJ specialist. My dad saw her. When I evaluated her, I didn't notice anything with the jaw. Everything looked okay. Her vertical dimension was normal. The range was great. There was no deviation. She was missing some teeth in the posterior portion on the right molar area, which I thought might be a problem, but her occlusion was fine. So just because you have malocclusion doesn't mean you're going to have TMJ problems, okay, or that you need to fix it. Anyway, we started working with her. Now, she'd already had 8 weeks, so I thought, I don't think this is jaw. I think there's something else going on. We started treating her for that she had forward head posture. I treated her for the upper cervical. Away went the blurred vision. Away went the in the ears. Away went the headaches. The jaw pain never came. It never was there. I just saw her today. She's doing great. She's feeling like $1 million. So that's why I say I think you need to look at that multivariable approach. Look at what's going on. You don't just say, hey, it's the jaw, and that's what I'm going to hit.
One thing, Tom, that I always tell everybody is that physical therapist A does not equal physical therapist B, which does not equal physical therapist C. You definitely need a therapist, not only with experience. I mean, experience isn't all of it, but that is willing to look at the total picture. Whenever we treat do an evaluation on a TMJ jaw patient, we're taking a tremendous look at the neck, because most times that is a primary driver.
Absolutely.
So we definitely have to look at that. I feel so bad for people that have spent money and wasted weeks and months getting treatment. It's just been, it's been kind of substandard treatment. So there should always be an exercise component. There should always, most times, be a manual component, whether it's done in clinic or whether the patient's doing it on their own. And there should always be a huge educational component as well.
Sure. And the other thing here too was that the patient's insurance, after all was said and done, they wouldn't cover TMJ. So what I found, 50% of insurances will not cover temporomandibular joint dysfunction. So, how do you, that's rough. Yeah, it's tough.
Yeah. We could spend a few hours talking about insurance.
No kidding, isn't that the truth?
But I think we also need to make the point that if anyone on this Facebook Live, either now or via the rebroadcast, has TMJ pain, and you go to see your dentist, don't just assume that your dentist knows that a physical therapist knows how to treat TMJ. Don't assume. You have to ask for it. And like Tom said, seek out one that has a lot of TMJ and neck experience. That's going to be your best option.
And you want the less invasive. Less is better when it comes to the TMJ.
Absolutely. So one thing, Tom, I always do with every guest is we finish up. I want to know what your mantra is. I want to know what's the phrase or the slogan or whatever that you live by. And because I like sharing. So tell us what you live by.
Yeah. So, well, for tonight, for the TMJ, less is more. By me, for my own, it would be, I think I tell people, or I think the idea that hold on tight to your dreams, because if you don't, you become part of someone else's. And you're never too old not to be able to learn more. So I gave you 2.
Oh, wow. 2? That's like a bonus.
Oh, there you go. Right.
All right.
There's stuff to learn.
Well, Tom, I want to thank you. I want to thank you for taking time to join us tonight. It means so much to me that you are here not only tonight, but you're here every night. I don't think you've missed one of my Facebook live. So I wish I could give you an emoji thumbs up, but right now I can't do that. So I'll give you a 2 thumbs up. But you are a tremendous person, and anyone in Chicago needs to go to Midwest Manual Physical Therapy because you are a man. So before we kick you out, Tom,
sure.
Tell me how people can find you.
Sure. We're right here in Des Plaines, Illinois. Gosh, I don't even know my number, Mike, but we're in Des Plaines, Illinois. Our number is 847-376-8289. Thank you very much.
And do you have a website?
We do. Our website is, what is it? MidwestCapitalMPT.com.
All right.
MidwestCapitalMPT.com.
Okay. How far is Des Plaines? Is it Des Plaines?
Des Plaines, DES, then it's a space, then PLAINES.
How far is it from like downtown Chicago?
Yeah. So, you know, Chicago traffic, one day it could be 30 minutes. The next day it could be an hour and a half. We're about 35 minutes outside of the city.
Yeah. All right. Well, the main thing is, how close are you to the nearest Lou Malnati's?
It's close. It's close. I tell you what, one of these days we're going to get an OGI course. I'm going to get an OGI course here. You're going to come down and Brian's going to come down and we're going to go to that Lou Malnati's. It's not that far. It'd be good.
Good. Well, hey, you have a great night, and thank you so much for joining us. And
Mike, thanks again.
I hope we'll see you back tomorrow. Okay.
Of course. Is it tomorrow? Are we back tomorrow? What's today?
Tomorrow,
Wednesday.
Yes. Today is Wednesday.
I'll be there. Yeah, it is.
All right. Thank you so much. Have a good night.
Thank you, guys. Bye now.
All right. Well, that was great that Dr. Mollsen could join us. He is, as you could hear from him speaking, what an intelligent human being he is, much smarter than I could ever be. So, Tom, thank you. Thank you. So please join me tomorrow night. We're going to start a 3-part episode, kind of taking a deeper dive into pain. And the main thing is not to go too deep with it, but I want everyone to, understand kind of what causes that acute pain, like the immediate injury. And then why do some people have this pain that just persists and persists, maybe long after the injury or the trauma to the tissue is gone. So we will definitely tomorrow start that, take a deep dive into pain to help everyone understand that. Thank you guys all for being here. I really appreciate you being here. Means so much. Thank you for giving me 30 minutes of your day. And please join me tomorrow night, and stay home and stay strong. Have a good night.